Hello, everyone. It's September the 4th. It's Friday. Monday will be Labor Day, and our next scheduled briefing will be on Tuesday. And of course, naturally, if we have events that come up over the weekend that would warrant, us to get together, we'll get together. I can assure you that everyone is still working, and everyone will keep working no matter how tired or no matter how fatigued or whatever it may be that we get. Everyone is going to continue to work until this is over. And regretfully, again today, I've got a whole bunch of not very good news to present to you. We've got 13 more deaths since Wednesday. I think it is always a respectful thing to do, and I'm going to continue to do that, and that's read every single one of these. The 231st death was a 64-year-old female from Kanawha County. The 232nd death was an 86-year-old male from Kanawha County. The 233rd death is a 95-year-old female from Mercer County. The 234th death, a 60-year-old female from Kanawha County. The 235th death, a 92-year-old female from Kanawha County. The 236th death, a 95-year-old male from Randolph County. Our 237th death, a 71-year-old female from Lincoln County. The 238th death, an 88-year-old female from Logan County. The 239th death, a 76-year-old male from Kanawha County. The 240th death, a 97-year-old female from Mingo County. The 241st death, an 84-year-old male from Logan County. The 242nd death, a 73-year-old female from Kanawha County. And our 243rd death, an 81-year-old male from Kanawha County. There was a mine disaster. I just thought of this. Years back. Where we had men that were trapped in a mine explosion, and we lost several men. I think we probably lost 11. I think we lost 11, and one man survived. Probably had a hard time, but survived. And I think how it dominated our news and how impactful it was on all of us, because we hated it, and it was a tragedy that none of us wants to be associated with any level of pain that those families were going through. But you see here, as of late, we've had that level of tragedy almost every other day. And so please don't get numb by these numbers. Please absolutely keep these people in your thoughts and prayers. I'm not going to get numb, nor Kathy, nor any of my people that are around me. And absolutely, I want you to just, some way, carve out enough time to keep these people in your prayers, because they're people, and we love them, and they've been great West Virginians, and they're great families, and so I don't know what else to say. But we have to go on. In regard to our numbers, we have 192 new cases in the last 24 hours. Our daily percent positive rate is at 4.96, which is terrible. Our cumulative rate continues to rise, but it's at 2.46. Our active cases are now at 2,344. That's up from 2,146 on Wednesday, which was a record on Wednesday. Our recovered cases are a lot. Our hospitalizations are not much different. They're from 146 to 152. If you look at this on a national basis, as we've done many times, these numbers are nowhere close to, I mean, any and every state would probably love to have these numbers, but I just keep looking that we've lost 243 great West Virginians. It's 243 too many. We now have a new county in the red, and one of our premier counties in our state, Mon County is now in the red with Mercer County. In the orange now we have Kanawha, Putnam, Wayne, Logan, Mingo, and Mercer counties. In addition to this, our RT number, which we were very proud of about a week ago, that we were tied for the third best in the nation. Now we're up to 1.22, and we're the worst in the nation. So you see, we've got a problem. We've got outbreaks all over the place, and we've got problems. And we're going to have to do any and everything we can as we continue to work, and just work and work and work. So, and maybe I mentioned Mercer County was in the red. It is Monroe County, and it's not Mercer County. So nevertheless, we've just got to continue to stay the course, protect ourselves, protect our family, protect the elderly. From the standpoint of our elderly, please, if you can, stay home. If you can, absolutely have someone run and get your groceries and everything for you, do that. And please, whatever we do, let's, as staff members of our nursing facilities and so on, where a great amount of these deaths are coming from, please, we can't afford to run off to Myrtle Beach and come back and do those kind of things. We just can't do that, because they're going to bring real sorrow to some. Now, in excess of half of the deaths in the state are at our nursing home facilities. Unfortunately, those are the people that are most vulnerable of all, and they're in a facility, and just imagine this, they're in a facility where they feel safe. They're not supposed to be invaded with this killer, and the only way that they can probably be invaded with this killer is it's brought in from the outside. So that involves us. It involves the staff. It involves the visitors. It involves us. Now, we've got to some way protect those people. So we just got to do better. We got to do a lot better. Yesterday, I want to touch on this just a second, but yesterday we had a great day in West Virginia from the standpoint of the economics. Our revenue numbers were terrific. The stability of our state, terrific. From the standpoint of an announcement about being able to make broadband a reality across this state, it could not have been a bigger announcement than it was just that yesterday. The greatness of the whole thing from my standpoint was the bipartisanship. We had, from the party across the aisle, we had John Perdue, our state treasurer. We had, our former Speaker of the House, Speaker Miley. We had, Roman Prezioso, the second in command, right, from the head in command from the minority side on the Senate. We had Bob Plymel, who's on the Broadband Council. On the other side of the fence, we had Mitch Carmichael, the Senate President, and Roger Hanshaw, the Speaker of the House. We had Daniel Linville. I'm going to forget certain ones, but we had we had a great amount of support, from not only them, but, from people that were, senators that were weighing in that weren't on the call. We had our state auditor, J.B. McCuskey, on the call. And everybody was doing one thing, and it was absolutely beautiful. Everybody was working in an absolute bipartisan way for the goodness of West Virginians. To be able to bring $766 million into this state for the construction of broadband to people that did not have access today. 121,000 homes. I commended everybody. I'm not going to go back through that and everything, but absolutely not 121,000 homes in all West Virginia, because we have broadband to a good bit right now, but we have so many areas we're deficient. But it was 121,000 homes that had no broadband today. In addition to that, we discussed how we had $50 million that was bucketed to go to broadband. Of how we could even take that even further. And this was a giant step, not just a baby step. This was the step to bring West Virginia into the future. We know that so many want to come to West Virginia and either bring their businesses or live here or do business from their homes here, and on and on and on. We know all of that. But at the same time, we also know that many won't come because we just don't have the abilities to have broadband here like they do have in many other states. So this was a gigantic step, a gigantic bipartisan step and everything. And so I am really proud and really thankful for all those that were involved. And again, thank you so much. Now, in regard to school openings, we have gathered information. Tomorrow, our school opening panel will be reviewing information, assessing information. We've been doing it, but tomorrow they will scrub numbers. At 9 o'clock tomorrow night, we'll be putting up the numbers, we'll be putting up the color codes and everything. From that, I am very, very hopeful that a great percentage of our state will be back in school. And I know just as well as I'm sitting here that it may very well be that we have right now, it looks like we've got 9 counties. Well, let me just check real quick, but we've got 6 counties in the orange and 2 counties in the red, and our panel will be reviewing all this tomorrow and putting the map up, tomorrow night. Again, I can't thank all the powers to be that have worked so diligently on this. Superintendent Birch, and Bernie Dolan, with the SSAC, all the medical team, DHHR, and Secretary Crouch and all of his team, Dr. Amjad, Dr. Marsh, so many, General Hoyer have worked, and so we're about ready to go back to school. Unfortunately, we're going to have some that we just can't, turn loose right yet and everything, which is in the best interest of the school and the best interest in, we don't want to start out with absolute failure. We don't want to put ourselves in a situation where if we're in the orange or the red right out of the get-go, we rush out and doom ourselves to some level of failure there. And so that map will go up at 9 o'clock tonight, tomorrow night, and then we'll go from there. I want to say another thing. I think that by some of the leadership of the teachers unions, there was some voicing of these type of opinions that they had been told by us that a county could not elect to go remote if they were in a color, I mean, other than, of course, in red, they have to go remote, but a county could not purely elect to just go remote. Of course, if they're red or orange right now, that's the only way that that we'll be able to educate kids until they get out of that and they get back to school. But a county cannot elect. Well, that's not correct at all. That's just as incorrect as it can be. What has come out, and it's come out through our SSAC and our Department of Ed, and that is just this, is if we basically take the choice away from the parents. You see, this is all driven by the parents having a choice. If they want their kids to study remotely, they have the opportunity to do so. But if the school is open and they want the kids to go to school, and right now, the overwhelming majority of parents across this state want their kids back in school. That's all there is to it. As much as 70% want their kids back in school. Now, and if they want them back in school, and then what we do is we allow them to go 100% remote, which we do. And I want to make sure everyone understands this. If a county elects to go 100% remote, they can do just that. But if they remove the choice from their parents, we don't think that that's what they ought to do. But if they do that, that's up to them. We're going to abide and support the local rule. But at the end of the day, if they do that, it would make no sense in the SSAC and the Department of Ed say concretely that basically what they're doing is they're saying if we have no instruction at the school and the school's not open, you're basically putting that county in the red. Even though they don't really technically move to the red, they're treating themselves as if they are in the red. And if that be the case, if they're doing so in an effort of safety, we absolutely can't have kids out on the football fields or kids playing volleyball and the school's not open. So there's just no way that you can have both. We absolutely support if a county wants to go 100% remote, they go 100% remote. That's fine. But if they're 100% remote, they can't play sports. You just can't do that. You can't. If the school's not open, we can't be playing sports. And it's not a penalty. It is just the way it has to be. For crying out loud, how's it? Forget how it looks, but just think about it. Think about it. You got the school closed, but yet you've got Friday night. You're out there playing sports. You can't do it. You just can't do that. And so the bottom line, I guess, is if it's too dangerous to go back to school, it's surely too dangerous to be playing sports. I want to talk to you just 1 second about this. Earlier this morning, and this is another wonderful, wonderful moment for me, from a bipartisan standpoint, we had on the call, former Speaker Miley, Roman Prezioso, Bob Plymel, on the Democrat side. On the other side, we had Roger Hanshaw, we had Amy Summers, we had Mitch Carmichael, and when we discussed, I think Senator Blair was on the phone. I think Senator Weld was on the phone. I'm not sure. I think Delegate Householder was on the phone. I don't know who else was on the phone, but nevertheless, we had several people on the phone, and we discussed just this. Superintendent Birch has told us repeatedly, over and over and over, that they have checked, double-checked, triple-checked, quadruple-checked, from the standpoint of every single superintendent weighing in as far as the school's PPE. Now, and so everybody is signed off from what I've been told on the fact that we have adequate PPE to start our schools back. Now, in addition to that, from a National Guard standpoint, we have, I don't know what it was, 2 million masks and all kinds of other additional PPE. And so with all of that, we're ready to go. In addition to that, everyone should know that we have, through the grant systems that the federal government provided us, we have allocated to the schools $911 million have gone, $91 million, forgive me, all these numbers are running together, but $91 million have gone to our schools. Now, in preparation for us to get ready to go back to school and all the other things that our schools are doing now through our Department of Ed. Now, just stay with me just one second. When we discussed this, we said, and my revenue department people, we've been going through this and going through, what can we do? What additional dollars do we have? And what can we do to do even more? So, our revenue department, and on the call we had our revenue people today as well, and they went through and explained this whole thing to all those that are on the panel and all those the advisors that were talking. And so basically what we're going to do unanimously, bipartisanly again, what we decided to do was set $50 million additional dollars over into a bucket coming from our CARES dollars to be there for two things. To be there for additional PPE for our schools and to be there for additional testing for our schools. So if we have any level of outbreak or problem that is beyond our current means, we will have an additional $50 million to address that. So that should more than that should more than put aside, give us the ability to put aside any concerns and move forward. In addition to that, you remember that there is another stimulus package on the way. We don't know if it's going to be here, in the next week or it's going to be 5 weeks away, but it's coming. I've told you about it and told you about just that. Now, first question that's going to come to mind is, well, where does the other $50 million come from? And where it comes from is just this. As we continue forward all the time, we continue down the path of just going here. We are constantly looking at the monies that we allocated for small business, the monies we allocated for unemployment, the absolute dollars and how and where they are in the buckets with the cities and the counties, where they are all throughout everything. That's what we do every day. Here's what we've done with Scott Adkins and workforce and on the unemployment dollars. We had $278 million in a bucket that's going to put our reserve back to life. We got that. Now, in addition to that, we put $400 million over in a bucket, and the two together were the insurance policy to keep us from having to raise taxes on our businesses going forward, and to completely assure that we would not have to raise our taxes on our businesses. We accomplished that. We accomplished that with the CARES dollars. Now, in going back and reevaluating, what we have done now is we have come to the absolute mathematical conclusion that now, because there's more people going back to work in West Virginia and things just keep getting better and better and better, we have set aside $78 million of that $400 to go to the $100 a week that we're paying everybody, that most all states are not doing, but some are, but we set aside that $100 to go to pay the people that are unemployed with the $300 coming from the federal government, giving them $400. That's $78 million of that $400. In addition to that, where we are now from June 30th to now is another $47 million of those dollars. And where we're going to have needs for from September 1 till December the 30th, and it is the 30th. I don't know why they didn't go to the 31st, but from now till December the 30th, is an additional $30 million a month or $120 million. So when you put them all together, you put the 120, the 78, and the 47 all together, you come to a number right at $250 million. We set aside 400. We've only have needs now for 250, and it continues to get better. So we're going to take $50 million of those monies that we set aside. We've got $150 million too much, and we're going to take $50 million of that and put it in a bucket to set aside for our schools' PPE or our schools' additional testing. And again, we had unanimous support on the phone. I loved it and everything. It's exactly the way we ought to be. Okay, as far as vaccine preparation today, I'm directing the National Guard and the DHHR to immediately stand up a vaccine preparation task force so that West Virginia will be prepared when the vaccine does come. I don't want to say I do not. I'm very hopeful. I hope and pray in every way that the vaccine does roll out in October. I'm very cautious, and so we'll be ready whenever it comes. Okay, this is a good thing. We've got several veterans organizations. We've got 279 of them across the state, and we have enough dollars to be able to do this. We sent our volunteer fire departments and our EMSs and people like that, dollars and everything. We're going to send all of these veterans organizations, and we've done this with the great work of Dennis Davis and our Secretary of our Veterans Assistance, and who's our Secretary of our Veterans Assistance. But we're going to send all of these organizations $5,000. It's going to go out. It's not going to require application. It's going to go out. Dennis is going to make sure that it goes and it gets in all these people's hands. These people haven't been able to do the normal fundraising and everything. At the bottom line of the whole thing is we have got to support our veterans in every way we possibly can. So we're going to send that money out. It's $1.395 million, and we're also going to continue to look and see if we could squeeze that up to 10,000. We're going to look at sending out another 5. But right now we're going to send out 5 and look at maybe backing it up with another 5 if we can. Our long-term facilities, as of today, we have 35 outbreaks. We have school outbreaks in Mason County at the Point Pleasant Primary School. We have an outbreak in Mingo County at the Mingo Central High School. And in Mon County, we have 29 cases from 12 fraternities and sororities on campus up there. From the standpoint of our churches, we have 4 active outbreaks that are going on right now, reported in Wayne, Monroe, Cabell, and Wyoming County. I continue to urge you to do the smart thing. I mean, look, you can't listen to your governor read through elderly person after elderly person, 13 people, 12 people, whatever. You can't listen to your governor read through that, or better yet, you can't listen to Jim, because really, as honored as I am to be your governor, I want to first and foremost be your friend, and I be a good West Virginian. Please, please, please take every precaution at church. We know just how dangerous the churches can be as far as the possibility of infection. So really watch what you're doing there. Wear your mask, stay a pew apart. If you can get church online and everything for a while, it may be the smartest thing to do too. From a corrections update, Mount Olive has dropped a little bit. We're down from 143 inmates to 122. At the South Central Regional Jail, there's now only 4 active cases there. At our Western Regional Jail, we have 1 active case. There's 5 active staff cases at the Beckley Correctional Center. Corrections have tested all the inmates and staff, or they're doing that today at that Beckley Correctional Center, and there's 40 staff and 40 employees that are there. And the National Guard is actively sanitizing these facilities. We continue to, we now have, I think this not, we got 3,300 applicants, from our small business grant program. It's going up. We've awarded $12 million. This program closes on September the 30th. Now we've got to hurry up. You've got to apply if you're wanting these dollars sent to you. We've got a total that have gone out to our cities and our counties of $103 million to 191 cities and counties, or these have been awarded, and so continue to apply. We'll continue to send the money as we can. We've got free testing going on tomorrow in Monroe County, and next week in Logan, Mason, Mingo, Morgan, Cabell, and Raleigh counties. And our summer feeding program, we sure don't want a person in West Virginia going hungry, and we've got 696 sites, and if you've got an issue, you can't figure it out, you're worried, pick up the phone and call 211 and we'll help you. Our census numbers are now up to 95.4%. I just, every time I see it, I'm just so proud of you, because this will mean an awful lot, for us for 10 years to come. So thank you again for getting counted, and a lot of news today, and we've got, what we want to do is start celebrating the fact, that when we get all of our counties down in the green and yellow, we're going to have a happy day. That's for sure. And I hope and pray it comes really soon. Anyway, thank y'all so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. It's great to be with everybody again today. As the governor said, that our RT number, the reproduction score, the rate of spread from person to person, has gone from 3rd best in the country less than 2 weeks ago. And today we are the worst in the country. And as we start to look at the map of incidence rates around the state, we see that we do have 2 red counties and 6 orange counties. And as we go forward, remember, this map is not really just a school map or a school opening map. This is a map around public health. And we know that the most important single parameter to be able to go back to school safely and to play the athletics that we love and to be out and around with each other in our beautiful state is to control the spread of COVID-19 in our communities. And as we look at the colors, as the governor said, our goal is for each county to help that county get to green, and if not green, to yellow. And so we know that we have work to do. And as the holiday weekend is approaching, we also know that it's really extra important for people to consider staying home. And if you stay home and you're going to socialize with people in your neighborhood or your community, then we really want you to be extra careful this weekend about wearing masks and staying physically distanced, wash your hands, because this weekend is another really critical weekend in our state related to our ability to start to turn around the spread of COVID, as we have the worst reproduction score in the country, because we really want to get that to come back down again. And that is a leading indicator of our ability to see those counties that are red or orange become yellow and then green. And West Virginia, you've been great so far, and we count on you and your love for each other, for your community, to do the altruistic work that you've been doing, to really double down this weekend and be highly cognizant that we have a lot of spread of COVID-19 in West Virginia, and we are seeing people die, as the governor said. So this is really the weekend to be very, very careful and to start to turn around that reproduction number back toward one of the best in the country and reduce the spread of COVID-19 so we can get back to opening schools in every county and we can get back to doing the things we love together. So thank you so much.
All right, thank you, Dr. Marsh. Next, we'll go to Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Ayn Amjad, our State Health Officer.
Good afternoon, everyone. We talk about our SUD problem in West Virginia on this call occasionally. It's not pandemic directly related, but it's absolutely affected by the pandemic. We still have an epidemic within a pandemic. So I want to announce that September is National Recovery Month. It's an opportunity to raise awareness about the importance of prevention and treatment and recovery from behavioral health and substance use disorders. It's also a time to celebrate West Virginians in recovery and the contributions of the West Virginian treatment and service providers throughout our state. We know that behavioral health is essential to overall health, prevention works, and treatment is effective. There is hope and recovery is real. On September 16th, DHHR's Office of Drug Control Policy and statewide partners will host a virtual prevention summit prioritizing prevention in West Virginia. If you or someone you know is seeking help with a behavioral health or substance use disorder, there are resources available throughout West Virginia. I think we have a slide, Jordan, with some information that's available.
It's on the screen right now, sir.
Yeah, thank you. So again, we want to encourage everyone to use these contacts on the screen. We have both a website, West Virginia Prevention Summit.org, and we have a toll-free helpline for those who need it. So please support those in recovery. Again, I want to thank so very much our workers throughout the state in our behavioral health centers and our mental health system. They're doing a terrific job, and as I always say, those on the front line are our heroes. So thank you all very much. Thank you, Jordan.
All right, thank you both. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Continue to work with the Department of Education on PPE as well as the Wi-Fi rollout. Continuing to work with the Bureau of Public Health on site visits to nursing home facilities. Also want to point out that the West Virginia National Guard received the certification to add an antibody test system into its mobile lab capability. Once that is finalized, we will begin to work first within the National Guard for those who have recovered to do antibody testing and begin to work with the American Red Cross on the convalescent plasma donations. And then we'll expand that out at the governor's direction to the rest of the population. Want to also reinforce that at the direction of the governor, we have reshaped our initiatives for the National Guard and focus more on quick reaction force capability. Examples of that in the last several days are the multiple sanitization missions. We supported Kanawha County with the annex building with an outbreak there, working South Central Regional Jail, Mount Olive. We've done a couple of high school locations, nursing homes, and we'll continue to focus on that. One last night I'm particularly proud of the National Guard and want to thank Captain Dwight Smasco for great work. We had a request last night about 9:30 for support at Meadowbrook facility here in Kanawha County. By 10 o'clock, we had people on the ground and helped work with setting up the isolation stations that were needed to segregate patients, working with the Kanawha County Health Department to make sure that we did the things that needed to be done there to mitigate the spread of a further outbreak in that facility. So I greatly appreciate the work of our folks and the efforts to be the quick reaction force going forward as we work through this pandemic. Thank you.
Thank you, General. We'll now go to questions from members of the media. The first today is from Brad McElhenney with West Virginia Metro News.
Hi, Governor. Boy, I hope you can answer this. It may be best directed to Superintendent Birch, but at the very bottom of the school reentry metrics on the Department of Education's website, it says the protocols set forth on this page will be in effect so long as the state as a whole remains below a 5% positivity rate on a 7-day rolling basis. And when I look at DHHR's site for the 7-day rolling basis, the last few days have been right around that mark. So what I wonder is, are there repercussions if the state hits that percentage statewide, not just county by county? Thank you.
Okay, Brad, let me make a stab at it. You know, I wish Clayton were here. He could answer it better than I, but let me just say this, and then I'm going to pass to Dr. Marsh or Secretary Crouch, but I think Dr. Marsh can answer it better than any of us. But here's how I understood it. First of all, you know, as we're going through this indexing, what we've got to do is we're first looking at the state being under the 5% threshold. And then we move forward with the color coding beyond that. But Dr. Marsh, jump in. Maybe you can answer that better than I.
Well, thanks, Governor. Brad, one of the issues that we look at the DHHR website is that for much of the data, this is reported as congregate plus community data. And so as we look at the total 7-day rolling average, that's not exactly what we're using for the color coding map. But the governor is right. We are looking at a 7-day rolling average of the percent positive cases over 7 days. And we really want that metric to be less than 5. We talked about that before. New York State has done that. You know, many documents talk about that. And if we look internationally, below 5 for sure, and then less than 3 turns out to be easier to contact trace and to make sure that we are having the appropriate abilities to identify people and then quarantine them, move them away from others. So that is the gating sort of first step for the state. And if we do go over 5 as a 7-day rolling average, then we would basically look at the entire state. We would look at where that 7-day rolling average increase is, because the presumption is that certainly wouldn't be everywhere. And so then that would help us start to focus down and understand which parts of our state are really driving that. And that increase is also another risk factor, you know, for being able to go back into, say, school safely. So that would stimulate us to look at the state as a whole and then try to move down to understand which parts of the state were driving that.
All right, thank you, Brad. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. My question is, I saw, and everyone noticed that the map changed today. After this color-coded map changed today after the schools, after it said it wouldn't change past 10 until tomorrow night at 10 o'clock or 9 o'clock. Sorry. My question for you is, can you talk about that? Will that be happening over the next 24 hours before we get these numbers for back to school? And what kinds of things will the group be doing tomorrow to adjust numbers as it comes to going back to school?
I think Clay and Bill and Dr. Amjad, all of them, you know, will be working through these numbers and everything. But Amanda, the bottom line is just this, is, you know, these counties that are already in the red and in the orange, you know, those are the counties we're going to primarily focus on. We may even be focusing on a county that is slightly yellow, or by that I mean is slightly yellow from orange, you know, and look at that. But our panel is going to be, you know, working these numbers and everything like crazy to see if there's not a congregate or community spread, and one needs to be placed over in one needs to be placed in another. But Clay, if you could take it from there, and but these colors could change, and they may not. But if you're already in the orange, or especially if you're in the red, those are the counties we're going to be looking at the most anyway.
So thank you, Governor. Bill, maybe I'll start and then I'll pass it off to you for any further comments, if that's okay. So what we're really doing, Amanda, is looking, first of all, from our DHHR experts and our epidemiologists to make sure that we have verified all the data, make sure that we have separated effectively congregate and community spread, making sure that we don't have any duplicates in the data, and that we've identified the county of origin for people who have had the positive results have been posted to their county. As we get the final verification of all that information, then we will have our panel start to look, as the governor said, at both 7 and 14-day rolling averages of incidence rate, of the percent conversion rate, and also a 7-day average or a 7-day listing of positive cases. And what we want to do, of course, is to make sure that we are fairly allocating and identifying the appropriate color code of the county. And, we'll be looking for things like the county size. So for instance, we found that if you're less than 16,000, which is 2 standard deviations from our median county, then we would assess that county by a 14-day rolling average of the incidence rate as corrected per 100,000 population. But what we've identified is there's other counties that are bigger that still may have a color change from a relatively few number of cases. And we really want an aggregate number of at least 20 cases to drive whatever that effect is. And so we'll be looking at those carefully, because if a county has turned, say, yellow to orange, and they've had less than 20 cases in a 7-day rolling average, then we would expand that view to a 14-day rolling average so that we could include an appropriate greater than 20 number of total cases. So the panel will be looking at all the data that's already been verified, and then we'll work with the governor to make sure that we are explaining and are very certain about this, because it makes such a big difference to each county. Bill, I'll pass it over to you for any other comments.
Thank you, Clay. And that's a good explanation. Let me just add that we're constantly trying to balance the speed with which we get information out and the accuracy of that data. As we've moved forward in developing this dashboard and in creating this process with regard to the maps using incidence rates, that information has been verified from midnight on the cutoff date till 8 o'clock the next morning. Very difficult. I've talked about receiving emails at 1 and 2 in the morning and later, are folks just trying to make sure that data is accurate. So it's very challenging from the standpoint of our staff trying to put this together. And so we're looking at the map for next week and trying to make sure that that information is accurate, so that what we put forward, which is going to be for a week, unless the county turns red, that map will be the map for education and for nursing home visitation for an entire week. So we want to be careful. We want to have a little bit more time. So the difference in the posting time here and what we were looking to do was to try to give us more time to really vet data, make sure it's accurate for those areas Clay talked about, congregate spread, duplication, and to make sure the county of residence is right. And these are done based upon the investigation by the local health departments. So we have a meeting with them this afternoon to talk about this a little bit more. They're great partners with us to verify that data and to make sure the information we post is accurate. So we're really trying to vet the data a little more, but we're still going to do that. We're going to vet the data and make sure it's accurate. And Clay's kind of laid out the process of how we're going to do that. So thank you.
All right, thank you.
Come back to me just 1 second. Amanda, this is why the beauty of last Saturday night, we were able to come out with color coding the last Saturday night, and with that, we have been able to dig down and dig down and dig down and make triple sure beyond belief and everything. And this is just what this effort really is all about. We want to be just as sure as absolutely we can possibly be, because we know the impact of this on lots and lots of lives. And we want to get our kids back in school, but we want to protect all those kids, teachers, service personnel. We want to protect everyone as best we possibly can. And we want to get them off on the right foot. We want it to start well and continue on well. And so you got a lot of people that are putting in the licks to make sure that it's as right as it can possibly be.
All right, thank you, Amanda. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. Hi, everyone. Dave Mistich, Public Broadcasting. My question is about response. Should these counties be in the orange and in the red? I know here in Mon County, you guys have taken some extra measures here in this county, but as we see, approach this weekend, coming into next week, the start of schools, is there a specific game plan to change response in counties that may be orange or may be red? And if so, could you outline that as specific as possible, please? Thank you.
Well, I really can't outline it as specific as possible, but I can tell you this from the truth side. We are looking at every one of these counties nonstop. And from the standpoint of taking more stringent measures to be able to get these counties down out of the orange and the red, we're going to do exactly just that. And if we can find a way that we think will really have an impact, such as maybe the bars need to be closed in another county or whatever like that, where we've got a lot of potential of young people going and congregating in masses or whatever it may be, like we had in Mon County, then we'll react to all that. But our people are working it, and believe me, we're watching it with all in us, and so we just but I don't know that giving you a specific would be wise at this moment.
All right, thank you, Dave. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. I have a question about the map and the changing and when it's going to be reported, and also the committee which will be looking at it. Following up on what Amanda said, it says the map's not going to change, and then it changes. I realize that, and I've heard many, many times how the Secretary for DHHR has said it's a challenging process, and we all recognize it's a challenging process. So how confident can West Virginians be that at 9:00 on Saturday night, which you guys set the deadline, nobody else did, 9:00 on Saturday night, the numbers are going to be the numbers. It's not going to be 9:15. It's not going to be 9:34, and they're not going to change 3 times. So how confident are you can get it done? And if you're not confident, how can you make sure that you get it done? And also, Dr. Marsh, how much input does the committee have that's outside of the numbers? Are the numbers the be all and end all, and whatever the numbers say, that's the way it is? Or if a county is right on the edge, does judgment and advice from the committee play a role in the decision as to what color will be assigned? Thank you.
Okay, Kenny, let me answer the first part, and then I'll defer to Dr. Marsh, and Dr. Marsh can go through it to whatever degree he chooses. But from the standpoint, are we absolutely going to come out at 9:00 right on the money? Absolutely, it's 9:00 right on the money. From the standpoint of trying to tweak and move and do the very best we can possibly do with that's why the beauty of last Saturday night coming out then. And then we tried to look at a way that we could use a non-school and purely sports week to really be able to maybe help and motivate and do all the different things, from the advantages from the medical side to right on down, and that's why we came out with those moves to tweak and move this thing. But I think when we come out on Saturday night at 9:00, in fact, I know there's no I think to it, the colors are what the colors are, and that's the way it's going to be. But Dr. Marsh, if you'd like to jump in there, please.
Sure. Thanks, Governor. So Kenny, the governor has made it clear to all of us that the key, as Secretary Crouch said, is to be accurate. And so the panel that will look at this data will have the ability to make those recommendations that the experts believe are going to serve those counties the best, be the absolute fairest to those counties, make sure that if things are right on the borderline, that the panel's looking at everything possible to decide and understand if the county really deserves to be in that higher color or lower color, because it does. As the governor said, this is a big deal. It makes a lot of difference to people of the county. And we want people to go to school, but we want people to go to school safely, both students and teachers. So we feel this is a great responsibility on all of us. And that's the reason why we're taking so much care to be able to do the verification and the assessment, looking at a lot of different parameters. So yes, the panel does have the leeway to make recommendations that are informed by experience and expertise to make sure that we are doing the right thing for each county to the best of all of the ability of who we consider the most expert people that could look at that data.
All right, thank you, Kenny. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor, and everyone else. I wish Scott Atkins was here, but maybe you can put some clarity to this, because I'm still getting calls and emails from viewers wondering where their unemployment money is. How much of the $100 checks, or how many people in West Virginia have gotten the first of the $100 checks, and if not, when will they be? And is this going to be a weekly thing? And obviously, we're still waiting for Congress to do something. They haven't come to any agreement, but people are wondering about their West Virginia share of that $400. Thank you.
Mark, I can assure you that the great people at Workforce are working that just as diligently and as fast as they possibly can. We had to wait first and foremost on FEMA, and then they've got to create a system in order to get it out. You know how government moves. It never moves as fast as what we want it to. And I wish to goodness that we could just have a way that we could just send the checks out instantaneously and everything. They're working through all that, and the only thing I can tell everyone is, everything's going to be retroactive back to the 1st of August, and so they'll get their full amount of dollars and everything. But Scott Atkins is working through it, and all I can tell you is those people are working very diligently to get it out, because we need. I'm pushing them with all in me, because I know wholeheartedly that you're sitting there worried about your power bill or your rent or whatever. You need to be getting those checks, and that's why we stepped up and said, we as West Virginia are going to underwrite the other $100. So we'll get them out just as fast as we can possibly do it.
All right, thank you, Mark. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, could you give us some more details about the vaccine task force that you mentioned? What does that consist of? What will they be doing? Are we allocating funds specifically for that? Could you give us a little bit more on that? Thank you.
I think the general can speak for that, but if you'd step up and speak for that, General Hoyer.
Yes, sir, Governor. So about a month ago, the governor, we had discussions with the governor. DHHR and the National Guard began to assemble personnel from Bureau of Public Health and the Guard to start to look at what it would look like for the vaccine distribution and the requirements needed. More recently, the governor directed us to ramp that effort up even more and to officially formalize a task force made up of staff from the Bureau of Public Health and the National Guard. We're looking at a variety of different things to include supplies that would potentially be needed. Will they be supplied by the federal government? What requirements will the state have to procure those? Locations for distribution, as well as storage requirements. Many of the vaccines that we have today require temperature control. So we've already placed an order for some equipment. We'll be looking at using National Guard facilities that have security and backup generators for locations to be spread across the state. We're also looking at what types of providers will be needed, hospitals, pharmacies, other entities that may be available to participate with the distribution. And we'll continue to refine that and be prepared when a vaccine is available in the future.
All right, thank you, Charles. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. September 8th is right around the corner. That also means that child care is in crunch time right now for parents that need to arrange that for systems that are in hybrid approach or whatever approach they may be needing. As we look at it as a state, what kind of stress has this put on the child care system? Is there enough licensed providers out there? What are you hearing back from the field? Maybe this is a Bill Crouch question.
Secretary Crouch, if you could step in, please.
Yes, Governor, thank you. And thank you, Paul. Good question. We can give you a very detailed update the first of next week, but we have many, if not most of our child care providers back up and operating again. Many of those got an approval through the pandemic to provide services for essential workers out there. We've now added others, but we think we're in pretty good shape. Part of the problem here is federal government has reduced or eliminated their child care subsidies in some instances. So we're looking at how we can try to kind of bridge that gap a little bit in terms of individuals who still need child care out there. But it's an important consideration as folks go back to school. Do we have enough? We know we do have some providers out there who are not reopening. So it's been a difficult 6 months or so for all folks, but childcare providers especially have had a difficult time. So we'll get you the numbers, the exact numbers, the first of the week before school starts. I think that's an important question. Thank you for that.
All right, thank you, Paul. Next, we'll go to Steve Adams with the Ogden Newspapers.
Yes, this is Steve Adams of Ogden Newspapers here. You obviously talked about the broadband initiative and waiving the caps on the EDA broadband loans in order to try to speed up the ability to try to take advantage of the FCC's auction. I assume by now you've probably seen a statement from Senator Manchin in regards to yesterday's bipartisan briefing. He didn't seem to be terribly excited about the program based on his statement. What are your, do you have any comments in regards to what Senator Manchin said yesterday? Thank you.
Oh man, Stephen. First of all, we had an opportunity to bring $766 million to the state of West Virginia. And everybody from the state auditor to the state treasurer, bipartisan, all across the aisle on both sides, everybody jumped all in and everything. And everybody says, absolutely, let's go. You know, I issue an executive order to be able to achieve just that. Everybody's in. Our Attorney General, everybody. Now, look, it's just high time and for us within this state to realize that we've got a senator that truly is putting his political desires above our state. It's either that or maybe Joe just, you know, wanted us to call his name more. And if I were to do that, I'd say Joe Manchin, if that makes him happy. I mean, you know, my wife this morning said to me, she said, you know, Joe must not have any idea what is going on and how how much it would mean to people that don't have, broadband, to have the ability to have that, and have the federal government step up and pay for that to be able to go to 121,000 homes that could never get that we've been chasing this forever. And then her next comment was, well, Joe doesn't even live here now, does he? The bottom line to the whole thing is yesterday was a great day, a great bipartisan day. We need to quit this crazy politics. We just need to quit it. I mean, that's all there is to it. If we absolutely are going to complain about having all these great people that worked on this and everything, and all I did was bring up the rear. By bringing up the rear and signing an executive order to be able to get this in motion. If we don't get it in motion, are we going to just sit on our butt and at the end of the day, let it just pass and lose the opportunity? Not me, not me. I think very, very, very childish and very self-centered.
All right, thank you, Steve. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Well, this question is from Ryan Quinn, so it'll probably sound more intelligent than usual. Why is the state not requiring county school systems to publicly disclose when they have positive test cases at individual schools?
Phil, I'm proud of you. Good job. That's a good one. But Dr. Amjad or Secretary Crouch, you guys answer this. This one's past my pay grade.
Sure. Well, we are, Phil and Ryan, we are announcing the school systems. I think the governor announced the one we had in Point Pleasant. So we have announced the schools because we do think it's a public health safety concern, and parents, teachers, and the public do need to know. So for the last two briefings, we have been announcing them. So maybe Ryan didn't realize that, but we have been announcing the school names actually, and we will be doing that. So
let me add, Phil, that I'm not real sure of the question, but we do require contact tracing. There's an immediate investigation. The child is removed from the room. Then there's a determination in terms of immediately which children should be quarantined, including teachers and staff. Rooms will be sanitized. So it doesn't necessitate a closure of the school, if that was your question. So I apologize if we didn't quite understand that. But there's certainly action taken by the local health department immediately to make very quick decisions with regard to any positive case in the state, regardless of the setting, whether that's a school or a church or a nursing home, et cetera.
Just want to say, and Phil, from my standpoint, I want Phil to know, I want the whole world to know, I want every single thing transparent at all times. If there's anyone out in the wilderness that has something, that could be released or whatever like that, and there's no holdup from my side, no holdup whatsoever. In fact, earlier on, I think I announced the situation in Point Pleasant and in Mingo County, and when the information comes to me, I'll surely announce it and everything. There's nobody holding it up on my end. I promise you that.
Thanks, Phil. Governor, that's all the questions we have. I'll turn it back to you.
Oh gosh, we just ended, huh? Well, let me say this first and foremost. We have a very serious situation in West Virginia. You have an RT level that's the worst in the country again. You've got people that are dying, and way too many. One's way too many, but we just read 13 more today. We've got a situation to where we're trying to get back in school, and we surely in the biggest part of our state need to be back in school. We need to be back in school everywhere from the standpoint that we don't want to walk away and lose our kids. Our parents are wanting their kids back in school. We've got so much that's hinging upon the great work of our teachers, and I hope and pray that they'll continue to just do great work upon great work like I know they're capable of doing. Now, you know, with all that being said, we got plenty of issues. I mean, if you just step back from it and you just think, and just think about, you know, how people are dealing with all this, you know, from the standpoint of, you know, whether it be Mon County's in green or in red today, or the broadband situation, you know, we've got to deal with it. We've got to deal with it right now. We're fortunate to come out with great revenue numbers, and it's just all over the park. You know, right here, they just handed this to me just a minute ago. This is great news. But Fitch, one of our bonding companies, just came out and said, Fitch affirms West Virginia's IDR and GO bond rating at AA. You know, just happened. This just happened and everything. But absolutely, there's tons and tons of work that went into play here. I was on the phone with Standard & Poor's and two other bonding company agencies, you know, and Fitch and what? I got S&P, but I've gone brain dead on the other one. You know, there was Fitch and S&P and Moody's. I'm sorry, but I was on the phone with them. We went through the whole thing. We got the Moody's one, came out just almost instantly and everything. We're still waiting on Standard & Poor's, and we got Fitch today. It's really important stuff, because as our bonds are rated, if they're derated to any kind of degree, it takes mega money right out of our coffers in our state. Our revenue people worked on this and work on it nonstop. I lead the call off, and then I leave the call, and they're on with these people all day long and supplying all kinds of information. Whether it be, somebody from the teachers union that would say, well, what about this? Or it could be just as simple as, someone calling saying, why doesn't my school get to play football? There's so many different directions that everybody's going, and this thing is so fluid, it's unbelievable, and it changes. I've said it over and over and over. Forget me, I'm honored to deal with every single problem, and I welcome the problems. But the people that are out there doing this great work need to be saluted and thanked, because they have done all-star type work. And we still got a long ways to go. And we know that. We got to all keep pulling the rope together, and we sure don't need to politically be throwing rocks at one another. It's silly. It's just plain silly. Do you know my campaign headquarters, I'm running for governor again, and my campaign headquarters in downtown Charleston, I've never been there. I've not been there one time. Absolutely, there's no time. I need to be your governor and do all I can possibly do to try to help you. And that's what I'm trying to do. But forget me, always just concentrate on the great people that are doing this work behind me. And not only that, let your prayers and your thoughts be with those people that we've lost, or the people that are really struggling, the people that are at home trying to wait until they get their unemployment check. For crying out loud, be with all those people that have done the great work in our grocery stores. Be with them and appreciate them. They have stood up for you in so many different ways. All the healthcare people, and forgive me for just going on and on, but just think about the courage that it took for our healthcare people to get on their scrubs and to go to work, to put on their masks, to put on all their protective gear as best they possibly can, and take care of our very sickest people, and then come back to their own families and wonder, am I bringing this home? And yet get up tomorrow and do the same thing over and over. So many first responders, so many really good workers. God bless each and every one of them. This is dog tough stuff, and it moves like crazy, and there's a lot of people doing and making the decisions, and I'll be dogged if they're not making really, really good ones. So God bless them. Thank you again so much for all the bipartisan support that we had on the panel today to be able to put the $50 million of CARES money in to assure us beyond any doubt that we've got the PPE and the testing capabilities at our schools. And thank you so much for all the great work that all those on both sides of the aisle did in every way with broadband. Thank you to our treasurer. Thank you to our auditor. Thank you to our attorney general. Thank you to all those that put the licks in. Just keep up doing the good work, West Virginia. We're going to emerge from this even better than we are right now. And so I can never thank you enough. Try as best you possibly can to be really safe over this Labor Day weekend. I hate like crazy. It's a sad, sad state of affairs when the holidays scare you. But they scare me right now, so be careful. Thank y'all.